Let me introduce my guest to you so we start this program this morning. Our regular panelist and editor-in-chief of the New Crusading Guide newspaper, you just heard a while ago, Abdul Malik Kubako, is here. And for those of you following on social media, I have posted a photo of his documents that he has brought into the house this morning, bags of documents. Kwame Sapong-Esiedu is pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana. He joins us via Zoom. Thank you once again, as always, for making the time to join us, Kwame.
Thank you, Samson, and congratulations, and good morning to listeners.
Thank you. Here, the man who has joined this show from the United States of America is now live and colored here in the studio. Dr. Samuel Kudwa-Mwakohene is an anesthesiologist, a COVID-19 ICU team leader at ECHN Health Network Connecticut. He's co-founder and president of Global Partnership, Halodyne LLC. Thank you so much for making the time to join us.
Thanks for having me, Samson, and congratulations again on the incredible award you received.
Thank you very much. And we will deal with COVID-19 matters briefly and spend the majority of the time on matters of security. And we'll be joined by Emmanuel Bombande, who is UN Senior Mediation Advisor and former Deputy Minister, Foreign Affairs and Regional Integration. I'm sure many of you associate and know him with his work as a mediation advisor or expert. Professor Kwesi Ening, Director, Faculty of Academic Affairs and Research, Kofi Annan International Peacekeeping Training Center, will also join us. So let's begin with Kwame Sapong-Esiedu. So take us back. How many of Ghanaians have so far been vaccinated, and how does it look? When are we likely to get Ghanaians actually in the vaccination?
Okay, so we would say around 400,000 Ghanaians, give or take, have been fully vaccinated. And then you've got another between 500,000 and 600,000 roughly who've had one dose of the vaccine. So that is the current state of play. To say when we're going to get vaccines, looking at the latest data, which I did yesterday, if you understand the vaccine technology, a number of countries did keep vaccines in stock. And because these are relatively new vaccines, their shelf life, which is the time between when they are manufactured and the time when they expire, is normally about 6 months. So there are some vaccines, especially in the United States predominantly, which are coming close to the end of their shelf life, which my expectation is would be hitting the supply chain. And they would be hitting the supply chain based on the preferences of the countries who are holding these vaccines. So you're talking about like the United States, as I did say last week at the G7, have promised 500 million doses. That would be hitting the supply chain from about July, early August. But one thing they'll be looking at is countries that can roll those vaccines out pretty quickly because they are close to the expiry date. And there, I think Ghana has a bit of an advantage because of what happened in the Democratic Republic of Congo and the fact that when those vaccines were sent to Ghana close to their expiry date, we were able to still roll them out very quickly. And so that would be a good thing. The other thing I'd want to say is that if those vaccines are Johnson & Johnson, there would be a second advantage, be it the fact that they are single-dose vaccines. So unlike the AstraZeneca and Sputnik, where you have to have 2 doses, the minute the people are vaccinated, 21 days after the injection, they would have gotten their maximum or optimum immunity, which would then mean that our quest towards herd immunity the pace might increase slightly. But from there to the end of the year, the route looks a bit charted because Serum Institute of India is not coming back on stream until the 8th of December. Biological E are saying 15th of November. And they are the ones who are producing. Serum Institute produces the AstraZeneca vaccine, which is Covishield, and biological ER producing Johnson & Johnson. So that's where the trick is. So I'll leave it at that.
So what's the danger that up to this point, we cannot boast of even a quarter of Ghanaians being vaccinated, those who are supposed to get their jabs getting it. And we continue to delay and push the time for those who are supposed to get their second dose. We continue to push it forward, suggesting as if, you know, now we are being told that even the more you wait to get the second dose, all the better. I don't get the explanation that is coming forward, because what we have been made to understand was that you get your first dose and then the date for the second dose, we have spaced it long enough. Now it does appear for as long as we are not getting the vaccines, we have good excuse.
Samson, no, I think I need to provide a bit of technical clarity here. First and foremost, when these vaccines were taken through their phase 3 trials, the time between the first and second dose for most of them was 3 weeks. So if you look at the United States, for example, they've kept to that protocol because that was what the Food and Drugs Authority in the US licensed, gave the emergency use authorization for both Moderna and Pfizer for. But when the UK's Joint Committee of Vaccination and Immunization looked at the total data from the clinical trials, they decided that even though it was 3 weeks during the the trial stage, there was sufficient data to spread it out to up to 3 months, and that if you did that and spaced it within 12 weeks, the spike of antibodies following the second dose is much higher, and the extent of immunogenicity is longer. But that was the data they had then. As things are going on, data is rolled out. Even yesterday, data came out from Public Health England saying a single dose after 14 weeks gives you a 79%, protection against hospitalization. So like I'm saying, the data is evolving. If you look at it at the moment, you would always see that Canada, for example, has a protocol where it's using 16 weeks. The length between doses is actually 4 months in places like British Columbia and Vancouver and other things, because the data points to 16 weeks, the antibodies being detectable at titers that confer protection. So I can understand the anxiety of the citizenry, don't get me wrong, because I would have gone with the 12 weeks. But I can also understand from a biomedical science standpoint that as the data comes, people are making informed decisions as they move along. You can argue that in places like Canada, where they've gone to 4 months, they have the vaccines anyway. But the point they are making is that because the data on a single dose is showing that it cuts the link between hospitalization and mortality, they would rather give more first doses and give the second dose after 4 months so that they can cut that link and minimize the chances of people dying. In our case, we are making the decision because we cannot get hold of the vaccines. But the good thing is the data seems to be giving us a bit of hope. And that's why I can understand the angst of the citizenry, but I can also not run away from the data as I review it, as Public Health England, Public Health Scotland, Clelit in Israel, FDA in the United States are reviewing it and putting it out in official documentation. And some of us are reading it and say, oh, what they are saying is not backed by science. At this point in time, that information is backed by science, and that is why I've given countries who have actually informed policy, like Canada, based on the new data.
Okay, I'll be playing for all of us to hear what the president has been saying about the attempts to get local vaccine production, and also the minister as well, Kwajman Menu, what they have to say about what we can do going forward. But do you think we are getting late, having spent all the time in wait for the third party that we had hoped will get us some vaccines, and from what the government has shown us so far, they have failed so terribly. All the timelines that they were giving. They had delivery schedule, that is Sheikh Ahmed, I'm sure we have heard about that, about the Sputnik vaccine supply. On the 3rd of March, they brought in 15,000 of the Sputnik vaccines. They delivered that. Then they were expected to bring in 185,300, right? That was not delivered at the end of March. Then April, 300,000 was expected, 600,000 also. That was not delivered. Then in May, 600,000, and then 1 million was not delivered. And then in June, 1 million doses, or 1.4, was also not delivered. The total of 3.4 million doses that was expected. This is where we are. We have pushed the dates over and again, and we are at this point, and yet there's no delivery. What are we required to do urgently to avoid circumstances that might hurt our country?
Thanks, Samson. I mean, I made this clear last week, and I'll repeat it again. It is clear that these guys are unable to deliver because they are only left with a July date. If you have 5 dates and they've reneged on 4, it would be strange to sit down and expect them to deliver on the 5th. At this point, I think there are enough breaches of that contract for the government to opt out. And I think there's enough grounds for them to opt out, because even if they deliver now in July and the supply chain improves in August, at the cost that they are selling to us, there wouldn't be any value for money. So that I am clear in my mind that the government has to abrogate the contract. However, what we have to do, the truth of the matter is, we can only rely on the vaccine supply chain improving. We cannot do a lot because we are bystanders. And sometimes people do not want to hear the fact that we are bystanders. But if you are not at the table of men with your hands in the food, you don't get to eat at the same time as the men who prepared the food. And that's the situation we find ourselves in. So I think the best bet now is for us to learn. I am quite sure this virus is not going anywhere anytime soon. There will be other clinical trials. There will be other vaccine development. We need to get to the point where there will be the political will for us to be involved in some of these things.
All right.
When we have the political will and we get involved, then yes, when vaccines are coming, we'll also be at the table.
All right. Now, Dr. Makohene, from where you sit, where you are coming from, they rolled out a plan and immediately started to work, and the population, greatly vaccinated and getting back to normal. Now, in the wake of fears of a third wave, how do you see what we have done so far, and what is the path that we should be charting to avoid plunging our citizens into a mess?
Well, good morning, and thanks again for having me on the show. I think it's really important when it comes to vaccination regarding COVID-19, because we know, as you've kind of alluded to, the fact that there's now a third wave, which is happening across the globe. When you look at India, the Delta variant that has really happened, every indication is that even people who have been vaccinated are now coming down with COVID-19, and some are succumbing to the virus. And so you ask yourself, in the developed countries, in America, in Canada, some of these places that we all know very well. For example, in the US, when the vaccination came on board back in December, most people were eager about, when am I going to get vaccinated? Now today, when I left the US, in New York City, most people are not wearing masks, because people are getting vaccinations. If you want it today, you can get it. And the goal for doing that was to ensure that we really do not go through a third wave. So that has been huge, because if you don't vaccinate your people as quickly as possible, then you leave yourself open for having these variants sort of becoming rampant in your economy, and the ramifications we are fully aware. And so for us in Ghana, having been here for days now, and sort of going through streets and how many people are wearing masks, and sometimes even watching people, you sort of, oh my goodness, what's going on? I think if you bring everything to who we are as citizens or as a nation, we have to really consider one thing. Do we have the resources? Should we have a third wave? What will be the ramifications? What will be the consequences? So the one example that comes to mind is when you look at Israel. They decided to make a decision, which was, do we allow ourselves to go through many or multiple waves of this variant, or do we go aggressive? Do we stay more proactive by doing everything we can to acquire vaccines and vaccinate our citizenship so that we can basically get back into economic activity and freedom and avoid a third wave? So I think as a country in Ghana, what we need to do is to really find ways and work with the right people. I mean, I think the word middleman has been thrown around quite a bit.
Yes, because the government feels that even though the most appropriate thing to do is to do government-to-government, right, transaction for the vaccines, if you are not doing government-to-government, as we understand, the government has actually been advised that you look for manufacturer connections. Don't deal with people who are not connected to the manufacturing, correct, or are not the government.
Correct.
But our government also feels that it is doing its best and it's not getting what it needs to get for the citizens. If it will get it through middlemen, why not?
Great question. I mean, I have been in contact with my colleagues in Canada and the US, and even within the Southern African countries like South Africa. Like when you take South Africa or the Southern African countries, most of those countries are not going through a third wave where they actually have curfews. They cannot get vaccines. I mean, South Africa is a different situation, as we all know. So getting vaccines is not an easy task. Talking to my colleagues, for example, in Canada and the US, what I know is the fact that you need middlemen are used everywhere. I mean, I think unless you are the developed countries who really have the resources, where you can go from essentially where they set up committees to do these purchases, you have to go through the right channels. So it's okay to use middlemen. You have to factor a lot of things into consideration though when you do that. For example, the Sheikh Ahmed situation that we're talking about, I think Kwame is absolutely right. When a person has not been able to deliver, or any group has not been able to deliver, I mean, I'm not here to make any proclamations, but it's clear that most likely that's not going to happen. You just need to find the right channel, the right resources, the right group. And with that, I believe we can get some vaccines. I do have an intel or information that may be able to help Ghana in getting what we need. But again, it comes down to really getting the right information and talking to the right team. There's no way I'm going to be able to sit here and in my own heart believe that a person who has not been able to deliver on 3 different occasions is suddenly going to be able to come up with 1 million doses of vaccines. And the last point I'll make is the fact that right now the supply-demand curve is really what's really controlling everything. So if you look at the many countries that are willing to pay in excess of $20 per dose, and we are here in the country thinking about, do we go for the money now versus the financial implications and the lives? If you could place money or value on a human life, if you could, do we value that more versus spending the money like what the Israelis did, the Israelites did, and getting people vaccinated so that we don't go through a third wave like India? So I think I conclude by saying that we just need to, continue to be proactive and really be at the forefront so that we can really get our citizenship vaccinated, because we're in a whole new situation. We're living in a continent where development is not our forte. We do like some few things that we totally can benefit from as a country. And so I think it's important that we put all that into consideration and ensure that we can do the best we can to vaccinate our people.
All right. Before we hear from the President and the Health Minister and 2 other persons who have spoken about looking for local manufacturing of the vaccines as a way out, Kwame, last week we spoke about the middleman connection thing, and here on the show I asked the question whether the controversy surrounding the middlemen bringing and not bringing, and they actually in the contracts suggesting that if anything happened they will not be held liable and so on and so forth, whether that will feed into vaccine hesitancy. We already have vaccine hesitancy. Whether that will feed into that a lot more. I think you were all in consensus that will also not help. Now, the FDA found that to be a situation where it needed to intervene. So it issued a press release to give assurance that the quality of the vaccines are good and they are safe and they are efficacious. Now, they say, and I need to read this part of the statement, they say that today the FDA has authorized the importation, distribution, and use of the 3 COVID-19 vaccines as follows: Sputnik V, COVID Shield, and then J&J. And they say that it is important to note that all these vaccines have been authorized for use in several countries across the world. For instance, Sputnik V has been authorized in 71 countries, COVID Shield in 170 countries, and Johnson & Johnson in 74 countries. On arrival of consignment, the FDA inspects each batch for compliance with the manufacturer's instructions on product handling and storage to ensure that the integrity of the cold chain has been maintained during transportation. Furthermore, samples are also taken for analysis to ensure that critical quality attributes comply with the approved release specifications from the manufacturer. All these processes are completed before vaccines, including vaccines from the COVAX facility, donation from MTN, and the recently imported Sputnik V are formally released to the Ministry of Health. Well, in that regard, they say the quality control measures required in the laboratory and required by the regulatory authorities are being followed to the World Health Organization standards, and therefore there's no cause for alarm. Even if a third party or a middleman was bringing it, we are assured that this will be gone through.
I sit here last week and I did say that if you understand the regulatory framework and how vaccines are moved in international commerce, you understand why the WHO gives emergency use authorization for some countries, because they do not have the regulatory gravitas that Ghana has. I mean, Ghana has one of the more robust regulatory authorities when it comes to medicines in Africa. I mean, you cannot take that away from them. And yes, I can, and I did say on here last week, I can agree with a lot of the things they have written. In fact, if they didn't do that, it would be in breach of quality assurance, because you need to sample every batch of a product that you've registered when it's gotten into your country. The issue with the middleman is not about the FDA not doing their job. It is about that middleman not having a contract with the local holder of the emergency use authorization. That's where the issue is. The issue is not about quality, it is about legality. So if I register a product in Ghana and it's within patent, if you want to bring it into Ghana, I either bring it myself or I can franchise someone to bring it, or the manufacturer, in this case, if it's Sputnik, the Russian Development Fund can bring it on behalf of somebody. If a third person is bringing it, because regulation doesn't allow you to register the product twice in the same country, then there are regulatory issues and legality issues there. So to end, what I would say is that, yes, the FDA will do all that. But another thing that the FDA would have to ensure is the collation of the adverse events post-immunization, which is the responsibility of the person who holds the emergency use authorization. That is where the real issue would be when a middleman brings it and issues that disclaimer, albeit the disclaimer is issued by all manufacturers. However, when it comes to the adverse effects post-immunization, it is the responsibility of the local procurer of the emergency use authorization. The question I ask consistently is, if we use a middleman, would the Ministry of Health take over that responsibility and any liability that comes with it.
All right.
We don't have answers, and that is where the problem is. So I don't have issues at all with the FDA's regulatory robustness.
Now, Dr. Makohene, what is the standard when you have, middlemen or third parties seeking to help Ghana to get the vaccines, and they are getting the country to sign onto contracts that sort of indemnify them from anything that happens? So if the vaccine is brought and it is used and there is some side effect or something happens that, they say don't hold us liable. Is that standard?
To be honest with you, I think a lot of these questions come across when you're dealing with people or groups or entities who are trying to insulate themselves from any sort of legal ramifications. Some of the wording or the legal language they put in there is really not necessary. As we all know, emergency use authorization means that we need to use such medications for the reasons for the challenges that we're being confronted with. So to me, that's not even necessary. You don't have to have those sort of protections in purchasing a vaccine as a middleman. It really comes down to having the right group, the right entity, because a lot of these are protected by the international standards. So you don't really need to set all these things or put all these on paper to try to insulate or protect yourself. If you truly believe that you're bringing in vaccines that are being produced, for example, the J&J vaccine that I indicated that we can get as a country.
Yeah, the U.S. says it has millions that it wants to give out. It doesn't want to use anymore, and it's about expiring. Okay.
So if you have that, why should, for example, myself or Uncle Kwaku say that, Samson, you have to protect us, right? If you're doing the right thing, you're delivering the right material and the right medicines, you should not be worried about what I'm bringing into the country. Then it comes down to the fact that these entities may not fully call themselves middlemen. They themselves may be going through different channels in purchasing vaccines. And I think we all as citizenship have to do the best we can to help our country.
Right. Now let's listen to, and I'll get Kwaku to give a brief view, even though he's insisting that as you let the experts talk, he'll give us a brief view of it. We'll listen to President Akufo-Addo on bringing in local production. Dr. Kwaku Agyeman-Manu also on bringing in local production. Dr. Nsia Sare has also been speaking about it. He advises the president on these matters. And Haruna Idrisu also is asking for some proof of some sort, whether that is still necessary in the wake of all the explanations that have come through. But some of our viewers and listeners are sending us messages and asking to know whether Dr. Kojo Makohene is ready and willing to make himself to the Jubilee House to assist in these processes. Let's listen to these people. We'll be right back.
The poorer, less advantaged nations are experiencing in having access to the vaccine. So that, of course, is the major challenge for us, the procurement and the issues of logistics involved in it. It has provided us a very important lesson. Among the many lessons that the COVID has revealed to us, the need for self-reliance in future in these areas. We cannot continue to be dependent on arms and on the charity of foreigners and foreign taxpayers for our basic sustenance. We need to be able to put in place the structures that will enable us in future not to be caught with our pants down. And that is that we have to learn and find the avenue to produce our own vaccines. And I'm particularly keen on providing the assistance for the institutions of our country to do so.
The government has set up a committee for vaccine production, chaired by the Minister for Environment and Science. They have also done a lot of work. Committee members are picked from the scientific world, some in the ministry and other scientific institutions. They are working very fast. They have even visited and they are partnering with private sector companies that were originally also preparing to produce some semblance of vaccines in our country. Looks like 3 of such facilities have been picked up, and they are liaising with the international community to see how they can start working. Their strategy is to try to do what they call filling and packing first, and then the science community will also take some time to start developing vaccines in our country. So that area is also seriously being considered, and we are actually on course in that direction. The African Medicine Supply Platform, we had registered with them. The one they were allocating to us, Johnson & Johnson, had not been released, registered in Ghana, not even elsewhere in the world. And they couldn't give us nothing. The indication was until August. So we didn't have much options to swim around. We had to go for Sputnik. We invited the Deputy Ambassador of Russia to the President's office. He couldn't tell us any significant thing. I was directed to write to the Trade Minister in Russia, the Foreign Minister in Russia, all those who mattered in this issue. Our direct contact with RDIF yielded no results. So we didn't have options than to go through middlemen, when we have said right from beginning that we wouldn't use middlemen in trying to procure vaccines. There was pressure back home that the president should make efforts to procure vaccines. We should rely only on the COVAX grant that was coming. What could you have done? We sat down with them, did a lot of negotiations. We agreed on $19. We signed the agreement, right? We were supposed to do LC for the first delivery schedule. Even that, they were not going to supply the 3.4 million at a go. They gave us a schedule of 300,000, then 1 million, 1 million, 1 million, spread up to June from April. We are not very comfortable with that. Our LC delayed for some reasons. When it got to them and it was confirmed, they sent us a message that they had run out of stocks. And up to I speak, they haven't been able to drop one single dose.
Government intends to vaccinate a total of 20 million citizens by end of year. The nation is currently inching closer to 1 million.
Vaccination. So far, we have actually vaccinated 852,047 persons who have had the first dose of vaccination. Then we have another 379,156 people who have so far also received their second jabs out of the 381,000 targeted. We're looking to do 381,000 based on the doses of vaccines that we had, despite the fact that our first jabs went round to 852,000. So here we achieved 98.something% target when we started doing the second dose for AstraZeneca.
The primary responsibility of the president is
the ministry signed a contract. They will look at all the contract terms and see if they have to abrogate it. If you look at that contract, you know, it was 3.4 million, but they were supposed to deliver it, what I read, in batches. Mm-hmm. And they pay only when it has been delivered. And when it's delivered, FDA checks everything before it's even brought into is used in the country. Gotcha. If you have seen what is happening at the airport, anytime any vaccine comes from anywhere, there's check the batch number, where it's coming from, and all sorts of things. So that is what will be done. But I will tell you that His Excellency, the President, for that matter, the government is seriously engaging. And as I speak now, we've engaged the U.S. government. We are trying to get vaccines from there, even apart from what is going to COVAX and what is going to the African Union. We've engaged the EU, specifically the British government, to also make sure that we get vaccines into the country to vaccinate our people, as well as the Prime Minister of India.
We are filing an urgent motion on the health sector and to request for a bipartisan probe into Ghana's procurement of COVID vaccines as $26 and not $10 as is the practice in many countries, and for which motion, as I've emphasized, will be to call for a bipartisan probe, because for all intents and purposes, we think that even that transaction is an international economic transaction within the meaning of Article 1815 of the Constitution. Parliament is not aware of it. We would want to appreciate and understand the procurement processes that were used, but more importantly, to demand value for money for the Ghanaian taxpayer, and that we are not just seeking to profit from COVID with this questionable transaction. So, Mr. Speaker, we will file an urgent motion. We've done that. I'm sure the table will give it to you before the close of session.
Right, so you heard the President, Nana Addo Akufo-Addo. You also heard Health Minister Kweku Agyeman-Manu, and then Dr. Nsia Sare, who is the Presidential Advisor on Health, and Haruna Idrisu, the Minority Leader in Parliament, seeking for some probe. Now, Kwame, so we know that at least 4 local pharmaceutical manufacturers are ready to provide the Ghanaian market with the COVID-19 vaccines. What exactly are we looking at with these local producers? And why didn't we look at this at the very start when we had the difficulties rather than running to questionable middlemen?
Thanks, Samson. I mean, the whole issue around vaccine manufacture is that Africa doesn't have a large manufacturing capacity. There are only 10 sites across 7 countries in the whole of the 55 countries in Africa who actually produce vaccines. And why is it the case? Because historically, diseases that require vaccination have disproportionately affected countries where, standard of living are low, purchasing power parity is low, and all that. So there is not a lot of money involved in the pharmaceuticals of vaccines. COVID has come in and it has tipped that uppercut. And that is why you realize that on average, new vaccines come every 8 to 10 years. This one has come in less than a year. And people are raising questions. It's because of the fact that that dynamic change. It's nothing like Ebola or dengue fever, malaria, and therefore the West do not have to be involved. This time they've had to be involved. What it now means is that African countries have also come to the realization that they cannot be reliant on these countries when a huge pandemic hits to supply them with vaccines, because unlike the diseases that I referred to previously, which do not affect these countries, even if they get the vaccines, they keep them in store for a public health emergency, but they have no real use for them in their country. So they would supply to Africa, like the childhood killer diseases and all that. But when there's a global need, then we go further down the pecking order, because they will prioritize their citizens who pay the taxes to ours. So what basically is happening now is we need to up the game when it comes to vaccine manufacture. You need to look at your pharmaceutical industry. You need to look at those who have the capability to produce vaccines and have what we call the ability to produce under aseptic conditions, because you don't want your vaccines to get contaminated. You identify those. You need to then get into bilateral agreements, because they need to be agreements with the people who hold what we call the market authorization, the people who actually made the vaccines and hold the patents, who will give you authority to manufacture. You need to then go into some form of collaboration to be sure that you can simulate their manufacturing chain, what we call good manufacturing practice. All these things would have to be looked into. And when they are looked into, your local regulator, which is the Food and Drugs Authority, also has to certify that the quality of production is the same as the quality of production in the country from which the vaccine originates for. That is where the political will is needed. And I'm glad that now government has realized, because to answer your question, why didn't we do that? This was what some of us were talking about as far back as May, June last year, that this is the approach to go, because that was what Chile did. Because I realized, for example, when it came to the masks, immediately the government and mask, and then call it the alcohol rub, the sanitizers, immediately the government gives support to local industries to go into them. And some of the masks locally made, they have been my preferred mask. I think one of the phone company, mattress making companies, either latex foam or ash foam, they make the mask, and you can see the quality difference with what we get from China.
So why have we waited all this while?
Yes, I mean, like you said, if you are making alcohol wraps and masks and other things, the technology is much easier. When it comes to vaccines, there's a lot more quality constraints that have to go into, because this is what you are injecting the thing into somebody. You don't want any form of contamination. You also don't want the concentration of what we call the active ingredient in that vaccine to deviate too much from what the standard says. So there's a lot more robustness. And then there's the need to upskill your industrial pharmacy team. I am a pharmacist, and I can tell you that all across Africa, industrial pharmacy hasn't been concentrated on. So even the human resources, when it comes to people who work in drug analysis, who work in quality control, who work in biomedical science, they are not that many in Ghana. Even pharmaceutical industries in Ghana struggle to get some of these people, because as far as I can remember, as it stands now, I know when it comes to drug analysis and quality control, the only university that does training is KNUST Faculty of Pharmacy, the pharmaceutical chemistry department. So if we have to do all these things, those things would have to change. We would have to learn to train people on the job, because the FDA also has the capacity to train QA and QC people and all that. So the government involvement is very, very important. And I hope that government is going to match this, not just with words, but with deeds, so that we can get this done.
Great. Now, Dr. Mwakohene, the president of the Pharmaceutical Society of Ghana, Benjamin Kwame Boche, says that they are actually waiting for the green light from the government to start with packaging. Now, as I listen to Minister Kweku Agyeman-Manu, I can also hear him talk about packing, or is it failing and packing? And then later, the science community will take some time to start developing the vaccines. Can you help explain what this means, that bringing the pharmaceutical, companies locally in Ghana into the system is not really about manufacturing the vaccine?
So it's a lot of the technicalities that you hear has to do with how a vaccine is made. As Kwame was alluding to, the first phase is to being able to make the vaccines. And then once you make the vaccines, you have to then put into consideration, how are you going to be able to store the vaccines? What for the vials that you're going to be able to put them in? Are you producing them right here? Or are you having those sent to you? So you make the vaccines in those manufacturing plants, but then you also have to look at the ancillary stuff or material that you need. And that is also some of what the Minister of Health was talking about, which is you have to be able to have the vials, if I have to pick that example. You have to be able to have the refrigeration. You have to be able to have the packaging. So when you look at the West, for example, the US, what we did, or what they did at the time, was they immediately engaged UPS and DHL and FedEx and all these other sort of companies to really help in delivering vaccines to the various different states or locations. And so I think some of that is what the health minister is talking about. Like, we need to make the vaccines, but we also need to consider how we get all the ancillary equipment and materials in ensuring that the vaccines that we produce are not just being produced and sitting in those manufacturing plants, but that we're able to package them, put them into the right containers and materials to really preserve them such that it can get to the ordinary citizen.
So you think that the state is on the right track in seeking to bring in local manufacturers, and as you listen to the minister, this is good?
I really do believe this is incredible news. One of the things that as I listened to the president, I was humbled by is the fact that we need to be more proactive. We cannot always rely on the West to help us out. In the US right now, we have millions of vaccines. People are not even taking them. Just yesterday or this week, the scientific community in the United States have decided that we've come to the realization that we probably will not be able to get to herd immunity, which is about 70% of our population, right? So we have millions of vaccines that we're sitting on, and yet we can't even get countries like Ghana cannot get those vaccines. Speaking to my colleagues within the Southern African country like South Africa, what was told to me was simply the fact that vaccines, as promised on the global stage, that Africa is going to be getting vaccines, they're not coming. And so if you cannot vaccinate your people quickly enough, you are at the risk of having various different variants coming. So it's essential that we really put these efforts in place. And if we can produce our own, I say this, Ghana will be at the forefront. And one thing that we have to always think about, everybody wants to go to the West. Development. If you are able to set up these pharmaceutical companies, one of the things that we're going to be able to do is employment for the people. And Ghana would then be able to produce vaccines for the rest of Africa, for example. That alone can change the fortunes of the country.
All right.
So I think it's a great idea if we can put our resources to it.
Thank you very much. In the next 15 minutes or so, we will get on Dr. Kwesi Enin. We will also have Superintendent Sheila Kesi Abeye Bachman, Director of Public Affairs of the Ghana Police Service, and John Ewua, who is CEO, Ghana Association of Bankers, as well as Emmanuel Bombande, to deal with the questions of insecurity in the country. But let me get Kweku's, brief comments on the hope that seems to be coming, however belated, and then I'll have Kwame and Dr. Mwakohene give us their final comments in some 2 minutes each. Yes, Kweku.
Yeah, there's a mixed picture out there. Good news here, and some, not too good news, if I may put it that way. It's a mixture, a mixed bag, but perhaps the potential for us to make progress is also discernible. And I'm going to be very clear on this. Last week, I asked for full disclosure on agreements and contracts that we have entered into.
That's right.
It appears we are dealing with multiple groups. It's important that the public knows which groups are we dealing with, what agreements have we entered into, what contracts have we signed, and what are the objectives, who are they? It helps so that when we are dealing with the issues, we deal with each one on its own merit. Otherwise, we box it up and there isn't any way forward. I still haven't had a very clear-cut disclosure as to which groups and how many groups we are dealing with. I would want the government to make that important. Now also, we told about contacts that were made with some governments. I thought it was only Russia, but we're now being told about the US, the UK, and the EU. See, information flow, put it out there, let people know. There's an emergency, quote-unquote, situation. There's some desperation, there's some frustration. Few people have been vaccinated. I'm lucky, I've had 2 already. But it appears that those who've had the first one, there's a huge, left over.
Yeah, for example, this texter, Collins Little Tete, he says that, or he's not the other one, there was somebody who said he feels very sad. Okay, that's Prince Henry in Koforidia. He says, I feel sad as a citizen because Ghanaians who have taken the first dose of vaccine don't know their faith, as in when they will get the second dose. Our leaders prefer to fly in most luxurious and expensive flights when the citizens cry for vaccines. So that's very sad. You and I have gotten our double vaccination.
Give out information. Let people, keep them updated. It lessens the frustration and the psychological trauma that some may be going through because of the situation. So that helps. I don't get too much of it. And I think it's part of the problem that we're confronted with. The president's intervention and the things he said, brilliant, good news in terms of the concept, in terms of the vision and the declaration. How the roadmap is also critical. How do we go about it? How are we going to operationalize that? It takes me back to the Nkrumah days. I'm sure we still have the Council for Scientific and Industrial Research. And you just mentioned the Pharmaceutical Society of Ghana.
Right.
Look, there was a National Research Council headed by the president himself, that's Nkrumah. In his absence, my good old man was the acting in his absence for that particular body. You'll be surprised if you go through the documentation. Plant medicine, traditional medicine, all those things were focused on. Of course, they had foreign collaboration from different countries because of the level of development then. I believe the Council for Scientific and Industrial Research is still around. They may be doing some work, but we hardly hear. And how are we connecting them to some of these points that the president has put out there? How are we connecting them? Information, when you are giving that info, it's reassuring, it's therapeutic, it helps.
That's right.
Relative to even the challenge that individuals like the texter is facing. He has hope. He believes that something is on the way. So just not the concept, throw the concept out, let people understand in a very simple terms, then seek to operationalize it, collaborating with bodies like the Council for Scientific and Industrial Research, the Pharmaceutical Society of Ghana, and I'm sure there are other relevant groups that do not come to my mind immediately. When we do all these things, it brings clarity and transparency and hope. Then you are building a certain national consensus. Aruna Idrusu may not be asking for a motion, may not be talking about bringing up a motion to seek a bipartisan probe of procurement if there's transparency and things. And I'll be honest with you, on this one, because of the Sheikh Maktoum thing, I'm inclined to accept that let's probe those things. Whilst we are doing things to save lives, it is not mutually exclusive. Okay. Let's also probe some of the procurement practices and things we've done. At this stage, it can help us cure any possible mischief relative to procurement practices. Okay? Because otherwise, it's so difficult. We need a national consensus on this matter to fight COVID. You don't need a situation where people will be talking at cross purposes. If we are all together, in spite of our political differences, and are focused on dealing with the enemy, in this case COVID-19, right, I think we'll make progress. This is a view of a non-expert.
And it's such a great view from the non-experts. And as part of what Kweku was asking for about disclosure, information, I want to refer to a statement that Professor H. Kwesi Prempeh made some time ago, and it surfaced on social media. I'm seeing it, and I suppose it's on the back of my take, is that a public office belongs to the public. Please, if you're in public office, this is the attitude with which you must be there. A public office belongs to the public, not to the temporary occupant of that office. A tenant is not a landlord. Don't allow yourselves to be taken for a ride, intimidated, insulted, cheated, or impoverished by people you have hired to work for you and who depend on your sweat and taxes for their livelihoods. They are your servants, not your masters. You are a citizen, not a subject. Act the part. Maybe you're waiting for Media Foundation for West Africa to bring an application for information to the Ministry of Health. And then you say either you won't give it to them or they should bring some 2,000. I mean, what's the point? What goes through your mind when a citizen is asking for information, basic information, and you are asking them to pay so much money? And then when they go to court, some of the courts to misconstrue the law's position and say pay so much. And I give you the example. Ernest Nogbe asked for information from the Electoral Commission. The court ordered that he should pay 1,500 for it. Electoral Commission denied him the information. He went to court. Court said Electoral Commission cannot deny him the information, but he should pay 1,500. Guess what? Eventually, when he went for the information, he paid the 1,500. But the information he was giving was on 2 pieces of paper, 2 sheets of paper. And the law says you should only pay for the reproduction cost. Photocopy 2,500. You are in public office. Give the information. Why? It's not yours. It's for the public. Okay. Now, Kwame, what will be your final, comments on how this country should go forward from the path that the president has spoken about, Kukwa Dwamenu has spoken about, that you applaud, that it is the way to go?
Well, I mean, we just have to progress. We have no choice, because this system we find ourselves in, where now the ministry, Ghana Health Service, are having to give people letters of intent, which is what they're technically doing now, so that when people get the vaccines and they have evidence, they can go into contractual agreements with them. It's a short-term measure. We cannot continue down that route. We need to be able to get to a place where we have actually got a stake in what we are asking for. Like the president said, we cannot rely on goodwill alone. And a lot of African leaders are saying that. So for me, this should be backed with deeds, but it would take a lot of work, like I've said, because we would have to train a lot of human resource. It's not beyond us. India have done it. Like I said, Chile has done it. I know Algeria has done it in Africa as well. So it is not beyond us. We can do it, but it shouldn't be a 9-day wonder. Let's assume that with some bit of luck, the supply chain improves from August because we are getting vaccines from the US and the UK and other things, or the new vaccine that is coming out, Novavax, also joins the supply chain, and things improve, and suddenly we put this on the back burner. Because the truth of the matter is, Samson, I'd end by telling everyone more pandemics would happen. And the likelihood, if you look at the global, population growth rate, is that this time they will come from Africa, because Africa is growing at the quickest. There will be a lot more urbanization. There will be a lot more contact between our citizens and animals in the wild. And as a result, there will be what we call zoonotic diseases. We cannot stop that. China is having it now, because now they are urbanizing quickest than the rest of the world, because they are going through massive industrialization. If you look at it, if Africa is going to industrialize, we would have our stake. The UK's and other things had it with the cholera and all that when they were going through their industrialization. It is something that happens globally, and we need to prepare for it. So we shouldn't make this a 9-day wonder. Thank you.
Thank you so very much, Dr. Kwame Sapong-Asiedu. Thank you always for making yourself available to educate and to assist us in looking for the solutions to the problems, particularly in the health sector. Now, Dr. Thank you. All right. So obviously, when you spoke with the future in mind. What we are doing now, we should also think about the future. Yes, Dr. Makohene, what will be your final words in, like I said to Kwame Sapong-Asiedu, in applauding the path that we have chosen? How do we ensure that we get the results? It does not become just talk. We do too much of it in this country.
That's the point.
So I think with everything that we've talked about and what the country is doing, and for that matter, the presidency or the government is doing, I sort of summarize everything into 3 sort of buckets. And the first point goes to the fact that we have to continue to engage with all the necessary or the right groups in helping us procure or achieve some of these vaccines coming into the country. Whatever we've done in the past, we have to continue to put our foot on the gas to try to get vaccines into the country. And if one path is not working, you really need to start looking around and not solely depend on someone's goodwill, because they may not. As you know, there's a third wave that's now hovering around and happening. What if the US or some of these developed countries decide to hold off? The Alpha strain, which is the British strain that came out, there's evidence that now there appears to be some more variants coming in Europe, right? So you cannot solely depend on that. So I think that's something we need to keep in mind and engage all the necessary groups to help us obtain vaccines as quickly as possible. And if we get some coming in, and at some point we have enough coming in, but some people are also willing to produce or give us suppliers with vaccines, then we can sort of back off and take what we've been offered rather than rely on people's goodwill. The last point I will make is a simple fact that it's a great idea. We need to put things into place in making vaccine. It's a global pandemic that it's affecting everyone. I do believe the presidency or the government makes the necessary effort. There will be a lot of, for example, the AU will be able to willing to partner with Ghana and support the country. Because if Ghana suddenly can put the manpower, I mean, we look at the universities we have fine universities. I do believe we can create that employment. And Ghana will be able to be at the forefront, a seat at the table, but also be able to produce vaccines for the rest of Africa. So I think we just have to put the right people at the table, and we can achieve them.
Right. But you say you are disappointed the few days you have been in the country looking at people's compliance with the protocols. What advice can you give? Looking that you have been a COVID-19 ICU team leader, you have seen people on their beds, and you've seen a lot of them just die because of COVID-19. What would be your advice?
I unfortunately have had the pleasure of watching too many people die. You know, I'll be the one spending 2 hours or more in the room when they will first be admitted in the ICU. I've taken care of Caucasians and Ghanaians in America, and I watched them die with family members not being able to come say goodbye. So I feel it. I think I was shocked when I first got into the country. It's easy for us to speak when we're outside because we've seen a whole different situation. I get into Ghana, and I saw one example that's so vivid in my mind was I saw a big bus, and it was filled with people, and I couldn't see a single person wearing a mask. And for me, that sort of broke my heart, because that is that's a disaster. You know, if we get into the third wave, no matter what government does, you're going to have to shut down.
The bus operators are supposed to insist on the protocols.
I've made the fact that this morning I'm so humbled by what you guys have been going through, that being here, I've learned a lot, and I'm just humbled by how I do believe that Ghana has been blessed. We're lucky, we're very fortunate, because if we get any strong, crazy variant, I don't know how we control it. And that's the more the need to really purchase vaccines, because people cannot adhere to these rules or protocols.
Okay.
So you have to do everything you can to.
All right. Yeah. Thank you very much. And when the pandemic broke initially, Dr. Samuel Kojo Amoakohene was giving us advice from the US, particularly about how we could use one ventilator, split it for multiple uses, one ventilator, so that many people can use it. Because that was what he was experimenting in the US, to assist people. There were many people who needed ventilators, but you go to the hospitals, there's one, and there are too many people who are dying and need the ventilator. Thank you so very much, Dr. Samuel Kojo Amoakohene. He's an anesthesiologist, a COVID-19 ICU team leader at ECHN Health Network, Connecticut. He's co-founder and president of Global Partnerships, Halodyne LLC. I'll share a few of your messages, then we take a break. When we return, we have the security experts joining us. And this one coming from Togbi. I always have a difficulty pronouncing your second name, your name really. It says, it is also important to consider the efficacy of the vaccine we intend to use. We might just end up like some South American countries like Chile, which vaccinated more than half of their citizens, yet infections still going up, leading to lockdowns. For me, a more globally known vaccine is better off spending our scarce resources on. Thank you for that message. Togbi Ngoyiri Fiaga.
A tough one.
Yes, forgive me if I didn't pronounce the name right. Then AJ Nyavo, John Nyavo, you say, how can President Akufo-Addo, a former foreign minister of this country, how come he's unable to use his diplomatic channels and friendships to buy genuine COVID-19 vaccines for us quickly? Okay. We should stop shopping in the black market. Jama Woyele says, with the benefit of hindsight, avoiding, okay, your message doesn't help the public. I'm not going to read it. But I'll advise you that when the vaccine is ready, please go for your jab. Dedome Kafui says, Newsfile, we could not vaccinate even 500,000. We have vaccinated 1 million, please. Yet we're able to register over 14 million to vote. All right. Collins Little Tete says that the politics surrounding the vaccine should be with clarity. At the end of the day, let there be no excuses, no explanations, and there will be certainly no regrets. Emery says it's a shame we keep proving Dr. Kwame Nkrumah wrong for saying the black man is capable of managing his own affairs. It is like we have been cursed to keep taking wrong decisions since independence. Kweku Abeku says, Newsfile, I took my first jab of the vaccine in the first week of April. I went to Accra to take a second jab because that was where I took the first one. Please, I want to find out if I am still protected when I take the second jab. Yes, they say you are still protected, and just wait when it's time for the second jab and you go for it. I'll read a final one from Charles Rekubrobe, tweeting at iTarzan. He says, local manufacturers may claim to be ready, but the patent holders of the current vaccines have to okay the technology transfer and assure quality. Future solution for now problems. Thank you. We take a break. We'll be right back.